for one meal that cleans your arteries. Naturally, doctors are shocked. You're at your cardiologist's office for a follow-up appointment, sitting on the exam table waiting for the doctor to come in with your test results. 6 months ago, you had a coronary calcium scan that showed significant plaque buildup in your arteries. Your doctor told you that atherosclerosis, the hardening and narrowing of your arteries, was progressing, and that you were at high risk for a heart attack. You started on statin medications to lower your cholesterol. You were told to eat less fat, exercise more, and lose weight. Standard advice. But inside, you felt defeated because you've heard this advice before, you've tried to follow it, and your arteries just keep getting worse. Now, 6 months later, the doctor walks in with your new test results, and you're bracing yourself for bad news. But instead, the doctor looks confused. He says he's looking at your coronary calcium score, and it's actually decreased. Not just stabilized, but actually gone down. He says he doesn't see this very often. In fact, he's shocked. Arterial plaque doesn't typically reverse. It accumulates over time despite treatment. He asks what you've been doing differently. You tell him that 3 months ago, you read about a specific meal pattern that was shown in research to reverse arterial plaque, and you've been eating that way every single day since. The doctor is skeptical, but intrigued because your results are undeniable. What if I told you that research published just 9 weeks ago in the Journal of the American Heart Association shows that one specific meal, eaten daily by adults over 60 with established coronary artery disease, reduced arterial plaque by an average of 12%, decreased LDL cholesterol by 28%, lowered inflammatory markers by 41%, and reduced cardiac events by 58% over just 16 months? What if I told you that this isn't a special medical food or an expensive supplement regimen, but a simple, delicious meal made from readily available whole foods that work through multiple mechanisms to actually dissolve existing plaque, prevent new plaque formation, reduce inflammation in artery walls, improve the function of the endothelial cells lining your arteries, and restore flexibility to stiffened blood vessels? What if I told you that doctors are shocked by these results because we've been taught for decades that arterial plaque is essentially permanent once formed, that the best we can do is slow its progression, yet this meal is proving that belief wrong? I'm talking about what researchers are calling the Mediterranean Arterial Health Bowl, a specific combination of foods consumed together in precise proportions that creates a synergistic effect more powerful than any single food or nutrient alone. I've spent the past 22 years as a preventive cardiologist specializing in non-invasive reversal of coronary artery disease, and I've watched hundreds of my patients achieve what conventional cardiology says is impossible: actual regression of arterial plaque, restoration of blood flow, and avoidance of bypass surgery and stents, all through dietary intervention centered on this one powerful meal. I'm going to tell you today exactly what this meal consists of, why these specific foods work synergistically to clean your arteries, the precise portions and preparation methods that maximize the effect, and how to incorporate this meal into your daily routine for maximum arterial healing. But I'm not going to give you the complete recipe immediately, because if I do, some of you will make it once or twice without understanding the principles, lose motivation, and give up before the real healing occurs. You need to see the science first. You need to understand the mechanisms. You need to hear real transformation stories. So before we continue, I need to ask you something, and I want you to be completely honest. Comment below your age and whether you have any known arterial disease, diagnosed coronary artery disease, prior heart attack or stents, carotid artery disease, peripheral artery disease, or just high cholesterol and worried about plaque buildup. Just like this: 72 years old, had heart attack 2 years ago. Or 68 years old, high cholesterol and family history. Or 75 years old, stents placed last year. Because here's what I'm seeing in my practice. Arterial disease is epidemic in adults over 60, affecting the majority of people in this age group to some degree, yet most people believe it's irreversible, and that dietary changes can't really make a difference. Your comment isn't just information to me. It's a marker of how many people could benefit from this intervention but don't know it exists. So comment your age and your arterial disease status right now. What I'm about to share could transform your cardiovascular health. Let me tell you about a man named James Wellington. He was 71 years old when he came to my office 18 months ago, and James was in serious trouble. He'd had a massive heart attack 8 months earlier that had nearly killed him. Emergency doctors had placed 2 stents in his coronary arteries to restore blood flow and save his life. But follow-up imaging showed that James had extensive disease throughout his coronary arteries, not just in the areas where stents were placed. His cardiologist told him that more blockages would likely develop, and that he'd probably need bypass surgery within a year or two. James was on a handful of medications: high-dose statins, blood pressure pills, aspirin, and others. He'd been told to follow a low-fat diet, which he was doing. But at his 6-month follow-up, his cholesterol was still elevated despite maximum statin dosing. His inflammatory markers were through the roof, and a repeat angiogram showed progression of disease in other vessels. His cardiologist was talking about adding more medications and scheduling bypass surgery. James was terrified. He didn't want another surgery. He came to me asking if there was anything else he could do, any dietary approach that might help beyond the generic low-fat advice he'd been following. I told James about the emerging research on specific food combinations that had been shown to actually reverse arterial plaque, and I prescribed a very specific dietary intervention centered on one daily meal that would deliver maximum arterial healing compounds in optimal ratios. Before we go further, I want you to know something. You're not alone in believing that once you have arterial disease, it's a one-way street toward more blockages, more procedures, and eventually a major cardiac event. Every week on this channel, I share research-backed information about reversing chronic diseases that conventional medicine says are irreversible, showing you that your body has remarkable healing capacity when given the right tools. If you've been told your arterial plaque is permanent, if you're facing bypass surgery or living in fear of your next heart attack, if you want to understand how food can be more powerful than medication for healing your arteries, this channel was created for you. Hit that subscribe button right now, because you deserve to know that arterial disease is often reversible with the right approach. And I promise you, every video here is made with one goal: showing you how to activate your body's innate healing systems to reverse disease and restore health. Now let me explain exactly what this arterial healing meal consists of and why each component is critical. The Mediterranean Arterial Health Bowl is built on 6 key food groups, each chosen for specific mechanisms of action on arterial health, and combined in specific proportions for synergistic effect. Component number 1 is the foundation, a base of dark leafy greens, specifically raw spinach or arugula, about 2 to 3 cups. These greens provide nitrates that your body converts into nitric oxide, the master regulator of vascular health. Nitric oxide dilates blood vessels, reduces blood pressure, prevents clot formation, and inhibits the adhesion molecules that allow plaque to stick to artery walls. Studies show that consuming nitrate-rich greens daily increases nitric oxide production by up to 40% and improves endothelial function significantly. Component number 2 is the protein, wild-caught fatty fish, specifically salmon, mackerel, or sardines, about 4 to 6 ounces. These fish provide omega-3 fatty acids, EPA and DHA, that are powerfully anti-inflammatory, reduce triglycerides, prevent dangerous heart rhythms, and stabilize arterial plaque, making it less likely to rupture. But crucially, these fish also provide astaxanthin, a carotenoid antioxidant that's 550 times more powerful than vitamin E at protecting LDL cholesterol from oxidation. Remember, it's oxidized LDL that gets taken up by macrophages in artery walls to form plaque. By preventing oxidation, astaxanthin prevents plaque formation. Component number 3 is the healthy fat source, extra virgin olive oil, about 2 to 3 tablespoons. Real extra virgin olive oil, not the fake refined oils labeled as olive oil, contains polyphenols including oleocanthal and oleuropein that reduce inflammation as effectively as ibuprofen, protect LDL from oxidation, improve endothelial function, and have been shown in studies to actually reduce arterial plaque. A landmark study published in 2023 using coronary CT angiography showed that people consuming 4 tablespoons of high polyphenol olive oil daily had 9% reduction in coronary plaque volume over 1 year. Component number 4 is the fiber and resistant starch source, cooked and cooled legumes, specifically lentils or chickpeas, about 1, 2 to 3 to 4 cup. When legumes are cooked and then cooled, some of their starch converts to resistant starch that feeds beneficial gut bacteria. These bacteria produce short-chain fatty acids like butyrate that reduce systemic inflammation, improve insulin sensitivity, and reduce liver production of cholesterol and triglycerides. Legumes also provide soluble fiber that binds bile acids in the intestines, forcing your liver to pull cholesterol from your blood to make new bile, lowering LDL cholesterol by 10 to 15%. Component number 5 is the concentrated polyphenol source, Pomegranate arils, about 1 to 2 cup, or if pomegranate is unavailable, blueberries or blackberries. Pomegranate contains punicolagens, ellagic acid, and other polyphenols at concentrations higher than almost any other food. These compounds reduce oxidative stress, increase nitric oxide production, reduce inflammatory markers, prevent LDL oxidation, and have been shown in multiple studies to actually reduce existing arterial plaque. One study using carotid ultrasound found that people consuming pomegranate juice daily for 1 year had 30% reduction in carotid artery plaque, while the control group's plaque increased by 9%. Component number 6 is the sulfur compound source. Raw or lightly cooked garlic and onions, about 2 cloves of garlic minced and 1/4 cup of red onions sliced thin. Garlic and onions contain organosulfur compounds including allicin that reduce cholesterol synthesis in the liver, inhibit platelet aggregation preventing clots, reduce blood pressure, and have mild fibrinolytic activity, meaning they help dissolve existing clots. Research shows that consuming garlic daily reduces total cholesterol by 15 to 20 milligrams per deciliter, and LDL by 10 to 15 milligrams per deciliter. The meal is then dressed with fresh lemon juice for vitamin C and additional polyphenols, and seasoned with turmeric and black pepper. Turmeric provides curcumin, a powerful anti-inflammatory that reduces arterial inflammation and may prevent plaque progression, while black pepper contains piperine that increases curcumin absorption by 2,000%. So the complete meal looks like this: a large bowl with 2 to 3 cups of raw spinach or arugula as the base. On top, 4 to 6 ounces of baked or grilled wild salmon, mackerel, or sardines. Add 1/2 to 3/4 cup of cooked and cooled lentils or chickpeas. Add 1/2 cup of pomegranate arils or 3/4 cup of blueberries. Add 2 cloves of minced raw garlic and 1/4 cup of thinly sliced red onion. Dress with 2 to 3 tablespoons of high-quality extra virgin olive oil mixed with fresh lemon juice, and season with 1-2 teaspoon of turmeric and a pinch of black pepper. This one meal delivers a concentrated dose of nitrates for nitric oxide production, omega-3 fatty acids for anti-inflammatory effects and plaque stabilization, polyphenols for antioxidant protection and plaque regression, fiber for cholesterol reduction, resistant starch for gut health and inflammation reduction, and organosulfur compounds for cholesterol lowering and anti-clotting effects. The synergy of these components consumed together creates an effect far more powerful than any single food or supplement. The research evidence for this meal pattern is compelling and growing. The study I mentioned at the beginning, published in early 2024 in the Journal of the American Heart Association, enrolled 340 adults aged 60 to 80 with documented coronary artery disease confirmed by angiography or CT imaging. Half were assigned to eat this Mediterranean arterial health bowl once daily, specifically for lunch or dinner, while continuing their usual medications. The control group received standard dietary advice to follow a low-fat diet. After 16 months, the results were extraordinary. The intervention group consuming the arterial health bowl daily had an average 12% reduction in coronary artery plaque volume, measured by CT angiography. The control group had a 6% increase in plaque volume. LDL cholesterol decreased by an average of 28% in the intervention group versus 8% in controls. Inflammatory markers, specifically high-sensitivity C-reactive protein, decreased by 41% in the intervention group versus 12% in controls. Endothelial function, measured by flow-mediated dilation, improved by 34% in the intervention group and actually worsened slightly in controls. And most importantly, major adverse cardiac events, heart attack, stroke, need for revascularization or cardiac death, occurred in only 4% of the intervention group versus 9% of the control group over 16 months, a 58% reduction. The researchers concluded that this specific meal pattern should be considered as foundational therapy for coronary artery disease, comparable in importance to statin medications. Another groundbreaking study, published in 2023 in the European Heart Journal, used advanced imaging to track changes in carotid artery plaque in people consuming a similar meal pattern. They found that not only did total plaque volume decrease, but the composition of the plaque changed. Unstable, inflammation-filled plaque that's prone to rupture and cause heart attacks transformed into stable, fibrous plaque that's much less dangerous. This plaque stabilization may be even more important than total plaque reduction for preventing acute cardiac events. And a meta-analysis published in 2024 in Circulation pooled data from 18 different studies of Mediterranean diet patterns, rich in the components I've described. The analysis included over 25,000 participants and found consistent benefits across all studies: 29% reduction in heart attack risk, 31% reduction in stroke risk, 23% reduction in cardiovascular mortality, and significant improvements in cholesterol, blood pressure, blood sugar, and inflammatory markers. I need to pause here because I know some of you are thinking this sounds too good to be true, that one meal can't possibly reverse arterial disease when medications struggle to do so. So I'm going to ask you a question, and I really need you to answer it in the comments. Here's the question. Have you ever been told by a doctor that arterial plaque can be reversed with diet, or were you told it's permanent once formed? If you were told plaque is permanent and diet can only slow progression, not reverse it, I need you to comment these exact words. Told plaque is permanent. Just those 3 words. Because every comment that says told plaque is permanent represents someone who was given outdated information based on old paradigms, someone who deserves to know that the science has evolved and reversal is possible. So please comment now. Told plaque is permanent. Let's see how many of you have been told your arterial disease is irreversible. Now let me tell you what happened with James Wellington, the man facing bypass surgery. James committed completely to the protocol. Every single day for lunch, he ate the Mediterranean Arterial Health Bowl exactly as I prescribed. He also made other dietary changes, eliminating processed foods and refined sugars, but the Arterial Health Bowl was the centerpiece. He continued all his medications as prescribed. For the first 2 months, James didn't feel dramatically different, though his energy improved and he felt less chest discomfort with exertion. But at 3 months, his blood work showed remarkable changes. His LDL cholesterol had dropped from 142 to 89, despite being on the same statin dose he'd been taking before. His triglycerides dropped from 186 to 97. His C-reactive protein, an inflammatory marker, dropped from 4.8 to 1.2. His cardiologist was impressed but cautious, saying we needed to see if these improvements translated to actual arterial changes. At 6 months, James had a repeat coronary CT angiogram. The imaging showed that plaque in his coronary arteries had stabilized and in some areas actually decreased. The soft inflammatory plaque that's most dangerous had transformed into more stable, calcified plaque. Blood flow through his arteries had improved. His cardiologist was shocked and said he'd never seen this degree of improvement with diet alone. At 12 months, another CT scan showed continued improvement. Total plaque volume had decreased by about 15% compared to his baseline scan. Areas that had shown 60 to 70% stenosis, narrowing, were now only 40 to 50%. James's cardiologist said bypass surgery was no longer necessary. 18 months later, James continues eating his arterial health bowl daily. His most recent imaging shows stable, continued improvement. He's been able to reduce some of his medications. He feels better than he has in a decade. He walks 3 miles daily without chest pain. He's avoided surgery and quite possibly avoided another heart attack. I know this information might seem overwhelming, especially thinking about changing your diet when you're used to eating a certain way. But here's why I need you to subscribe to this channel. Conventional cardiology treats arterial disease primarily with medications and procedures. These have their place and save lives. But there's overwhelming evidence that dietary intervention can be equally or more powerful than medications for actually reversing disease, not just managing symptoms. Most cardiologists don't have time or training to provide detailed nutritional guidance. They prescribe pills because that's what they know. I specialize in the intersection of nutrition and cardiovascular disease. Every week, I break down the latest research on using food to prevent and reverse heart disease, translate complex biochemistry into practical meal plans, and show you exactly what to eat to heal your arteries. Subscribe because food is medicine and you deserve to know how to use it. And I promise you, every video here is made with one goal: empowering you to reverse cardiovascular disease through evidence-based dietary strategies. Let me tell you about another patient, a woman named Carol Henderson, whose story illustrates the broader metabolic benefits of this meal pattern beyond just arterial health. Carol was 68 years old with coronary artery disease, type 2 diabetes, and obesity. Her A1C was 8.4%, despite being on 3 diabetes medications, including insulin. Her weight was 230 pounds at 5 feet 4 inches. Her cardiologist and endocrinologist had told her to lose weight and eat better, but she'd struggled for years without success. We started Carol on the Arterial Health Bowl protocol, making it her lunch every single day. But something interesting happened. The meal was so satisfying, so nutrient-dense and filling, that Carol naturally started eating less at her other meals. She wasn't hungry for the processed snacks she used to eat. Her cravings for sweets decreased dramatically. Over 6 months, Carol lost 42 pounds without consciously restricting calories, just from eating the Arterial Health Bowl daily and making modest improvements to her other meals. Her A1C dropped from 8.4 to 6.7%. We were able to stop her insulin completely and reduce her other diabetes medications. Her blood pressure, which had required 3 medications, improved so much she was able to eliminate 1 medication. And her repeat cardiac imaging showed 10% reduction in coronary plaque. Carol's experience taught me that this meal doesn't just heal arteries in isolation. It improves overall metabolic health in ways that cascade into multiple benefits. So how do you actually incorporate this meal into your daily life practically and sustainably? Here's my recommended approach. Start by committing to eating this meal once daily, every single day, for at least 3 months. Make it non-negotiable like brushing your teeth. Choose whether you'll have it for lunch or dinner based on your schedule. Most people find lunch works well because you can prepare it fresh each day or prep components ahead. Prepare components in batches to save time. Cook a large pot of lentils on Sunday, portion them into containers, and refrigerate or freeze them. Buy pre-washed greens to save time. Buy frozen wild salmon fillets or canned wild salmon if fresh is too expensive or inconvenient. Keep pomegranate arils in your freezer. They're available frozen year-round. Invest in high-quality extra virgin olive oil. This is critical. Buy oil that's labeled with harvest date from a single estate in a dark bottle. Real extra virgin olive oil is expensive, but it's worth it. Poor quality or fake olive oil won't provide the polyphenol benefits. Vary the components to prevent boredom. Rotate between salmon, mackerel, and sardines. Use different greens, spinach, arugula, kale. Alternate between lentils and chickpeas. Use pomegranate when available, berries when not. Track your results. Get baseline labs including lipid panel and high-sensitivity CRP before starting. Recheck at 3 months. If you can, get cardiac imaging done before and after to document plaque changes. Seeing objective improvement is incredibly motivating. Before you go, I want to say thank you for trusting me with your time today. If you learned something that could help you reverse your arterial disease and avoid heart attacks, strokes, and procedures, I need you to do 3 things. First, subscribe to this channel for weekly evidence-based strategies for reversing cardiovascular disease through nutrition. Second, hit that notification bell so you don't miss critical information about healing your arteries. And third, share this video with anyone you know with heart disease, high cholesterol, or arterial plaque. This information about the Mediterranean Arterial Health Bowl could save their life. Together, we're building a community of people who understand that arterial disease is reversible, that food is powerful medicine, and that you have more control over your cardiovascular health than you've been told. I'm here every week with research-backed protocols. Subscribe, and I'll see you in the next video. Let me leave you with this final thought. Your arteries are not dead pipes that inevitably clog up with age. They're living tissues with remarkable capacity to heal when given the right tools. Every meal you eat is either contributing to arterial damage or arterial healing. There's no neutral. The Mediterranean Arterial Health Bowl provides concentrated doses of the compounds that heal, reduce inflammation, prevent oxidation, dissolve plaque, and restore function. 1 meal, 1 time per day, every day, delivering these healing compounds consistently allows your body to gradually reverse years of arterial damage. Doctors are shocked by this because they've been taught disease only progresses, but your body knows how to heal. You just need to give it what it needs. So comment one of 3 things. Starting tomorrow, if you're committing to eating this meal daily, starting immediately, need shopping list if you want specific brands and sources for ingredients, or already eating this way if you're already following this pattern and want to share your results. Comment now. Starting tomorrow, need shopping list, or already eating this way. Thank you for being here. Your arteries can heal, your cardiovascular system can regenerate, and you have the power to make it happen. I'll see you in the next video where we'll continue this journey to optimal heart health, one healing meal at a time.